So today I want to offer you a comprehensive summary of how our immune system fights cancer and the principles of cancer immunotherapy, which is today the most effective approach to treat advanced solid tumors, and notably those that can't be removed with surgery. So first thing that you need to know is when cancer is growing, it will always have some tumor cells that are naturally dying in the periphery. When that happens, the dendritic cells, which receive this name because of these three branches-like structure that they have, they capture some fragments of these tumor cells to start training the lymphocytes, specifically the T lymphocytes that will recognize and terminate this cancer. So these T lymphocytes recognize the tumor fragments using these receptors here that are called T cell receptors, or TCR. So I want to open brackets here for one of the most hedgehog topics out there, and that's being generous, which is about diet. I don't know what you're eating out there, or if you are into intermittent fasting, which is also called time-restricted feeding, and we are having an entire podcast episode just to cover this topic, by the way. But for now, if you want this process here to work efficiently in your body, you want to make sure that you have sufficient amounts of vitamin C or ascorbic acid in your diet, okay? And the reason why is because vitamin C is fundamentally important. It's a microchip. It's a microchip to build the TCR receptors in the T cells. Just so you know, insufficient amounts of vitamin C lead to the deficient generation of T lymphocytes. And the reason why is that these lymphocytes cannot survive without their T cell receptors. Their survival is intrinsically dependent on some pulses or signals that are released from these TCRs to keep them alive. So that said, vitamin C is important for the T cells to make TCR receptors so they survive. Otherwise, their lifespan won't last even a week. But the importance of the TCR receptors when it comes to providing immunity against cancer is so that the T cells use these receptors to recognize the tumor fragments being presented by the dendritic cells. So when this process happens efficiently, these T cells will start growing in numbers, and they will attack the cancer cells at the place where the tumor is growing. And this place is called the tumor microenvironment. So they will recognize the tumor fragments, the same ones previously presented by the dendritic cells in the lymphoid organs, and in doing so, they will start releasing here some toxic substances that are called granzyme B and perforin. So these are toxins. These toxins will make pores in the cell membrane of the cancer cells and will kill them in a process that is named apoptosis, which is, by the way, a more sophisticated form of cell death compared with necrosis. It is important to know also that vitamin C is ultra important in this process. It was just recently published in two respectable scientific journals. One is the Journal of Clinical Investigation, and the other is the Proceedings of National Academy of Science, PNAS, very reliable journal, that ascorbic acid or vitamin C is needed to synthesize increased levels of these substances, these toxins that kill the cancer. So the problem is that when these T cells start releasing these toxins and they will feel that they are beating cancer, they already start expressing their surface a shutdown button. That happens because the T cells normally fight virus and bacteria infection, and this kind of battle usually lasts for 1 or 2 weeks long. And after ending the infection, they naturally express these shutdown buttons. It's a natural process. So they believe here, at this point, that this cancer shouldn't last for too long as well, and they will start expressing the shutdown buttons on their surface. But the tumors are not even close to being stupid, so they immediately identify these buttons and they start pressing them to turn off our immune cells. So when that happens, our beautiful T lymphocytes here, they will not only become exhausted and stop working, but tumors will recover and escape the immune pressure. So when this mechanism was discovered, the scientists start developing a new type of therapy, which is called immunotherapy, which changed the way that cancer is treated today. They developed antibodies that are called checkpoint blockers. When they inject these antibodies into the patient, the antibodies will bind the shutdown buttons in the T lymphocytes and will hide them from the tumors, which can no longer press them. Turns out now that our T lymphocytes will now continuously attack the tumor cells until complete elimination of the tumor. In this article that I just mentioned that was published in these prestigious journals called PNAS, the researchers also found that the combination of immunotherapies with high doses of vitamin C potentiates even more the effectivity of the lymphocytes. Even the dendritic cells, by the way, are positively impacted in this process, which starts secreting more interleukin 12. And interleukin 12 is a kind of a message, a text message that will tell your body to prepare your peripheral defenses to fight metastatic cancer. Okay? It raises a type of army that systemically will fight cancer. So even the dendritic cells are impacted positively with the vitamin C. So in a nutshell, this is how our immunity fights cancer and the principles of cancer immunotherapy. And also be mindful what you are eating or leaving aside in your diet, because foods that are high in vitamin C levels, they can really impact and enhance your immunity against cancer, which is a process called cancer immunosurveillance. See you in the next video. Bye-bye.